Meet Rebecca. Rebecca is somebody who considers herself to be a bit of a perfectionist. She considers herself to be somebody who's detail-oriented, independent, and who has a strong sense of moral and ethics. At work, she's a high achiever and a leader. But sometimes Rebecca finds that she gets slowed down by trying to make things perfect, and has trouble getting things done on time. As well, she often has trouble giving up responsibilities to others and feels uncomfortable when things don't go exactly as she plans. One day, at the recommendation of a coworker, Rebecca tries seeing a clinical psychologist to see if there's anything she can do to help manage these difficulties. After a consultation, her psychologist concludes that Rebecca might have obsessive-compulsive personality disorder. Now let's explore what that means. Obsessive-compulsive personality disorder, OCPD, is a personality disorder where an individual feels the need to control all aspects of their environment. Individuals also experience a persistent pattern of extreme perfectionism. There are 8 personality traits that can be used to characterize OCPD. These include rigidity, which is the inability to be changed or adapted, miserliness, which is the excessive desire to save money, perfectionism, over-attention to detail, hypermorality, and the inability to assign tasks. As we can see, Rebecca did exhibit some of these personality traits, such as difficulty assigning responsibilities, excessive perfectionism, over-attention to detail, and not adapting well to change. OCPD is related to other medical and psychological conditions. For example, OCPD shares some similarities with OCD as they are both obsessive-compulsive disorders. That being said, obsessive-compulsive personality disorder and obsessive-compulsive disorder are not the same thing. Before we go on, if you would like to learn more about OCD, you can watch the following videos on the Demystifying Medicine YouTube channel. To begin, OCD is an Axis 1 disorder. This means that it is a clinical disorder. Axis 1 disorders tend to be episodic with a treatment timeline and recovery plan. As the name suggests, obsessive-compulsive disorder is characterized through obsessions and compulsions. Obsessions are intrusive thoughts and impulses that are often inappropriate and can increase anxiety. Compulsions are ritualistic actions that individuals suffering from OCD feel compelled to perform in order to decrease their anxiety. These obsessions and compulsions do tend to be contamination-related or harm-related. This type of disorder is considered ego-dystonic, as the obsessions and compulsions do not align with the person's self-image, and often they want them to go away. On the other hand, OCPD is an Axis 2 disorder. This means that it is a personality disorder and is made up of personality traits. It does not involve obsessions or compulsions, rather the traits discussed prior. OCPD is not ego-dystonic but ego-syntonic, meaning that the individual sees their behavior as regular or positive. Obsessive-compulsive personality disorder is characterized by a preoccupation with orderliness, perfectionism, and mental and interpersonal control. This obsessive need for control can cause problems in relationships, work, and everyday life. Treatment of obsessive-compulsive personality disorder usually involves psychotherapy. Cognitive behavioral therapy is often used to help patients manage their symptoms. Cognitive behavioral therapy focuses on improving dysfunctional behavior by changing the way people think. Cognitive behavioral therapy effectively treats symptoms because it helps deal with the underlying causes of obsessive-compulsive personality disorder. This includes techniques that help patients identify and challenge their thinking styles. This can help overcome the symptoms of OCPD. The overall goal of treatment is to help patients lower their strict expectations and focus on the value of close relationships. The other purpose is also to help patients gain the tools to help them relieve some of the symptoms experienced from OCPD. It tries to give them some flexibility in their rigid thinking, allowing for better interpersonal relations. CBT is usually paired with relaxation techniques to alleviate some of the stress and anxiety from OCPD. While there are no medications specifically designed to treat this disorder, Antidepressants may be prescribed to help with associated anxiety and depression. As a disclaimer, this video is for education purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. After participating in cognitive behavioral therapy, over time, Rebecca finds that she's getting better at completing things on time and at sharing responsibilities with others. For more information on OCPD, feel free to check out some of the videos we've highlighted here or the resources linked in the description down below.